Good day, dear friends. As you can see today, I have my dear friend with me, who, as you can see from his face, is experiencing pain in his lower back. The pain started after lifting weights. It has been going on for several days, and now we will start treating him. But first, let's determine what happened. What exactly went wrong there? Now I am testing the straight muscle of the thigh. The right one does not work, the left one works. One muscle is turned off and now we are unloading the vertebrae. I ask him to slightly raise himself on his hands to increase the intervertebral gaps. We test the muscle, nothing changes. The weakness of the muscle is not related to nerve compression. I am testing the lumbar muscle. We are testing the lumbar muscle in a non-standard way because the knee still hurts a bit. The right one does not work, and the left one works. The lumbar muscle, as you know, goes from the transverse processes of the lumbar spine and attaches to the femur. Its main function is to stabilize the lumbar spine and extend the leg forward with each step. Now we are testing the quadriceps muscle of the lumbar. The left one is working. We stretch it. We test it after stretching. It turns off. This indicates a shortening of this muscle. We are testing the right one. Here's the right one. It's not working. That's usually the case. On one side, the muscle turns off. On the other side, the same muscle becomes short. We are conducting a test on the oblique muscle of the abdomen. The right oblique muscle of the abdomen is not working. The left oblique muscle. There is no weakness in the test, but it is shortened. If stretched, it will also weaken. And so we have three weak muscles. Those that stabilize the lumbar, the quadratus lumbar muscle, the oblique abdominal muscle, and the lumbar muscle. So here I decide to do a manipulation on the lumbar section of the spine because I decided that there is compression in the upper lumbar section since all these three muscles are weak. I'm doing this movement. If this is the case, then the lumbar muscle, the quadratus lumbar muscle, and the oblique abdominal muscle should be activated, and possibly the straight muscle of the thigh. The straight muscle of the thigh does not activate here. We'll find out why a bit later. Again, you see, it doesn't maintain its tone. Here, I decided to mobilize the ribs in order to restore the tone of the oblique abdominal muscle. On the inhale, I mobilize the rib to restore its mobility, and then we work on the attachment points of the oblique abdominal muscle to the ribs, and the transition points of the oblique abdominal muscle to the rectus abdominis muscle, thereby restoring the muscle tone. After we've worked on the attachment points, we test the muscles once again. The muscle has come into tone, started working, and now we give it a little load so that it comes into tone during exhalation. That is, the patient exhales and strains the muscle. It's better to do this after the muscles have been activated so that it starts to recover faster, starts to engage in movement faster. We do the same with the quadriceps muscle of the thigh. That is, we activate it through such strains. In essence, we are doing the same movement as during the test. By the way, you can also do it with breathing exercises. We are checking the lumbar muscle. Our lumbar muscle has also started working. And finally, we test the straight muscle of the thigh again, which still doesn't work. But here, as it turned out, there is also a problem with the mobility of the kneecap. When a sleeping process occurs around the kneecap, its mobility is disrupted, and this causes weakness of the straight muscle of the thigh. Here we relieve tension in the muscle of the thigh, allowing the kneecap to move better. And after this, the tone of the straight muscle of the thigh was restored. We test the straight muscle of the thigh again. That is, it already works in a static position. Now let's look at the tilt. It weakens when tilted. Why does this happen? When tilted to the other side, it works. We are checking for shortening and excessive tension in the quadratus lumborum muscle. When the patient leaned to the right side, the quadratus lumborum muscle was strained, and in this position, the gluteus maximus muscle was deactivated. This indicates that there is a shortening of the quadratus lumborum muscle and compression of the nerves that come from the intervertebral foramen to the quadriceps muscle. To eliminate this, we need to relieve excessive tension and shortening of the quadratus lumborum muscle. There are several ways to do this, but here is one of the fastest and most effective ones. That is, of course, you can also apply cross-fiber massage, but this method works a little faster. That is, I fix the muscle itself with my fingers and the patient makes the movement. And it turns out that under my fingers, the muscle fibers are stretching. The fascia is stretching. And so, you can locally remove excessive tension and shortening. Shortening, in this case, of the quadriceps muscle of the thigh. As you can see, initially our right quadriceps muscle was weak, but after we restored its tone, it turned out that there was also a shortening in this muscle. Now let's try to make some more movements. A lot of discomfort in the movement remains, so we will look at other positions whether this affects the work of the muscles. Other movements. We see that when turning to the left side, compression of the nerve also occurs because the muscles have recovered, but the fixation of one joint has remained, which we will now remove. Here I place the patient in such a way as to affect exactly the joint that is fixed between the lumbar vertebrae, between the third and fourth lumbar vertebrae, and I carry out the manipulation, restoring movement in these details. Checking one more time. I used the test again to determine whether I was able to perform some manipulation correctly, and with the help of the test, I determined the effectiveness of one or another action. Now, I give the patient recommendations. That is, he should independently massage the attachment points, massage the quadriceps muscle of the lumbar, removing the shortening there, and do exercises for the quadriceps muscle of the lumbar and the oblique muscle of the abdomen. This is the exercise for the quadriceps muscle of the lumbar, lying on the side, slightly lifting the legs, moving them back. Like this. Hold it like this for 10 to 20 seconds. Do several approaches. He will need to do these exercises for several days for his oblique abdominal muscles. He needs to do it for the muscle to start working again. While breathing, and began to fully move the ribs. In this case, we got such a quick result because the pain was only a couple of days. If the patient experiences pain for half a year or 1 year, then of course such a quick result will not be obtained because during this time he could get myofibrosis. Muscle shortening becomes more prominent. A strong limitation of joint mobility and fixation occurs. But the most important thing is that muscle hypertrophy also occurs. During the time when the non-working muscles are not in tone, they are so reduced in volume that after you turn them on, their volume is still insufficient to perform their function. Well, at the same time, we will also check the condition of our patient's neck. Testing the neck flexors. They are working. Long neck flexor. But his left sternocleidomastoid muscle is not working due to the instability of the clavicle. We activate the subclavian muscle. We massage it. We turn it on. Then, we put a little load on it. The patient strains a few times. We test again. And the pectoral muscles are working. Then mobilize the first rib on exhalation. After all this is done, we need to check the mobility of the first vertebra, because even if at least one of these muscles doesn't work, fixation and shortening of the neck flexors often occur. But it all depends on how long it was going on for. And it's better to restore the mobility of this vertebra, although very often when restoring the tone of these muscles, it starts to move on its own. But in this case, we'll also correct it. There was a limitation of movement on the right side here. There was a limitation of movement between the joint, between the first vertebra, and the occipital bone. Well, in this way, we conducted the treatment. Well, friends, put likes, subscribe to the channel, leave your comments if you like this video, and see you again.